I learned so much from all of my teachers, who I am forever grateful to. And I was involved in so many activities. There was so much that the Mehlville School District had to offer, and it was a really great place to get my education. Some of the most memorable things were participating in student council and National Honor Society, but also really enjoyed being in women's choir and show choir and a lot of the theater productions.
She was always interested in science. What was fascinating to me is she knew what she wanted to do from a very young age, and it never wavered. And she was pursuing that from like day one.
Early high school, one of my best friend's little sister got leukemia, and so I thought, oh, maybe I want to be that kind of doctor. And a few years after that, a kid in my own extended family developed a childhood cancer, and so I really knew I wanted to be a pediatric oncologist. I went to college at the University of Miami, where I majored in microbiology and immunology, and it was there that I really fell in love with immunology. I entered the MD-PhD combined program at St. Louis University. After I completed the MD-PhD program, I went to UCLA, where I completed my pediatrics residency. And then I did my pediatrics hematology and oncology fellowship at Stanford.
The first time that I heard about Dr. Mavers, it was from my colleague in Stanford. Washington University is very well known for its state-of-the-art immunology and state-of-the-art immunotherapy or cell therapy. So I think that this is a great place for somebody like Dr. Mavers.
Well, I really wanted to care for patients and help patients and families during this difficult time when they're dealing with cancer and facing that diagnosis. I also wanted to be part of helping to develop better treatments and better cures and less side effects, and so that's where the research side came into it for me. My real focus is on what's called hematopoietic stem cell transplantation or bone marrow transplantation. When we put the donor cells inside the patient's body to fix the problem or to fight the cancer, these cells can also sometimes start to attack the patient's healthy tissues. And so that's a really bad complication that can cause a lot of problems for patients and even be fatal. And so in my research, we're trying to use ways to harness the immune system, which already has some immune suppressive elements in it, that enable us to combat that graft-versus-host disease, to prevent it or treat it.
Bringing a new way of therapeutics for cancer that is pretty, I would say, revolutionary.
She is currently having and is going to have a major impact in the world. I mean, she's helping people every single day. She's changing people's lives with the research and with the work that she does, the clinical work that she does. She's making her mark on this world 100%.
I think for all parents that have gone through that, seeing, really brilliant, dedicated, empathetic people like Dr. Mavers continuing to do the hard research that can help the next group of kids that are going to come in and be diagnosed with something like this. It's comforting to know that those people are still working on it.
When I talked to her when I was recruiting her, it was always, I want to, do something to alleviate the pain of these kids with cancer. And I think that she's very goal-oriented, and that's what have allowed her to succeed.
She sought out what schools, what fellowships, what was going to give her the knowledge that she needed to be able to meet that goal.
I'm very grateful to all of the teachers for their dedication to the students in Mehlville School District. And I think it helped me to be a well-rounded person. At times, I can't believe I'm being inducted when I read about the accomplishments of some of the other inductees, because it's an amazing group of people, and I just feel very honored and privileged to be a part of that.